Dr. Claudio Tomella, who is also an old friend coming from Italy. He's MD, nutritionist, and anti-aging practitioner in Milan. He currently practices anti-aging medicine, nutrition, integrative medicine in Italy, as well as giving course and congress worldwide. He's going to speak about beyond obesity phenotype, new horizon in personalized diet, supplementation, and drug management. Please. Okay.
AI can analyze millions of data, but it doesn't know what it means to wake up with a bitter taste in your mouth or feel tension in your muscles. Traditional science has built its success on identifying what works for the majority. But what happens to patients who don't belong to the majority? Back in 2013, science presented a revolutionary concept, the recognition that some obese individuals are metabolically healthy while some normal weight individuals are metabolically unhealthy. Adipose and muscular organs, as two metabolically active systems essential for health and longevity, require a dual-focus approach. The one-size-fits-all anti-aging strategy doesn't exist. Different morphotypes require different nutritional and supplementation strategies. Actually, we have excellent pharmacological tools to act on insulin resistance, obesity, and diabetes. From another perspective, sarcopenia can be reversed with precision nutrition, target exercise, and strategic supplementation. But the real secret is another. Combining food with each other in the right way and using the properties of the different foods and way of cooking can influence nutrition in relation to different areas of vulnerability and body composition. This allows for excellent prevention and treatment, and the patients will thank you because they will feel better immediately. So, I speak about integrative functional nutrition. I describe physical and psychological features, vulnerable areas, and functional nutrition guidelines. I suggest specific supplementation strategies considering the morphotype. In integrative functional nutrition, meals are structured on the basis of the Mediterranean diet and draw recipes from traditional Italian cuisine. This method, that comes from a functional metabolic approach, teaches to choose, cook, and associate foods according to the functioning of organs and the specific needs of the subjects to treat the symptoms and prevent disease. To structure the diet, we make use of the study of the human constitution types resulting from traditional Chinese medicine. The human constitution types are 5: liver, heart, adrenal, pancreas, lung, and kidney. Human constitution type 1, liver. In the liver constitution type, there is a prevalence of the sympathetic nervous system. The general shape of the body is gynoid, and fat is localized mainly in the lower body, with very evident waist. Those who have this liver constitution have a spatial vitality in their eyes. They tend to be dynamic, fast, and responsive. The subjects are usually weak in the liver metabolism and biliary system. They often have bitter mouth in the morning, constipation, or gut dysbiosis. Laboratory tests shows high or low transaminases, low platelets, low iron, and hypercholesterolemia. In these constitution types, foods that boost liver function to improve estrogen metabolism will be chosen. For optimal liver function, an adequate portion of energy deriving from easily assimilated carbohydrates and water contents of fruits and vegetables will be necessary. Citric acids, vitamin C, and foods rich in potassium can be very helpful, as well as nutrient and phytonutrients supporting phase 1 and phase 2 of detox. So avoid foods rich in xenoestrogens and cheese that limits worsen the liver function, and limit foods to rich in iodine or X-axis stimulating. For this constitution type, uroretin A can be used as a potent geroprotective and detoxifying agent. Uroretin A is a natural metabolite produced by gut bacteria from ellagic acids, a polyphenol found in various plant-based foods. It's a pleiotropic molecule and extends the lifespan and improves healthspan parameters such as muscular function, acting mainly through mitophagy, supporting mitochondrial function. It has anti-inflammatory and antioxidant properties, supporting phase 1 and phase 2 of detox. Human constitution type 2 heart adrenal. The distinguished feature of these individuals is to have a very efficient adrenal gland activity. The former has a predominant localization of fat in the upper area of the body, in the districts most stressed by androgen hormones and cortisol, with little evident waste. It is active, resolved, with good adaptability and incapable of assuming position. Vulnerability areas: cardiovascular disease, high blood pressure, hypercoagulable blood, glycemic imbalance, or diabetes type 2 related to hypercortisolemia. Laboratory tests show high levels of platelets, hematocrit, cholesterol, uric acids, and urea. To contrast the enlargement of the upper part of the body, it is necessary to include in the diet foods that improve the function of the kidneys and also the elimination of body fluids. We must not use foods that promote the synthesis of androgens and the activities of the adrenal gland. So, avoid anything that impairs kidney function, such as red meat, which also stimulates the synthesis of androgens, and excess minerals and antidiuretic food associations, and limit sweets and foods with high glycemic and insulin indexes. In this constitution type, we can use SGLT2 inhibitors to counteract insulin resistance and beyond. SGLT2 inhibitors are drugs that reduce blood glucose levels by enhancing urinary glucose excretion, while simultaneously promoting cardiovascular and renal protection. Recent studies demonstrated that they are also pleiotropic and geroprotecting agents. They are able to improve metabolic flexibility, and they promote cell cleaning by increasing autophagy flux. They can activate key anti-aging molecular pathways such as AMPK, sirtuins, and PGC1 alpha. Recent research has even shown that they are able to stimulate Clot, and preservation of Clot expression represents a link to both heart and kidney protection, while also promoting longevity, of course. Human constitution type 3, pancreas. The prevalence of the parasympathetic nervous system slows down overall metabolism, with the accumulation of visceral fat located mainly around the waist and hips. The face is round and the subcutaneous tissue is soft, so the keywords are round and soft tissues. The appearance is calm and reassuring, and they have great difficulty with adaptation. There is an increased risk of developing diabetes type 2, insulin resistance, and hypothyroidism. Since the pancreas endocrine and exocrine function often go hand to hand, subjects that belong to this constitution might suffer of digestive disorders such as gastritis, pancreatitis, colitis, with a prevalence of diarrhea or fermentation dysbiosis. Laboratory tests show high blood glucose and insulin levels, elevated triglycerides, amylase, and TSH. In this type, it is recommended to stabilize blood glucose and insulin levels and to boost the thyroid function. So, avoid foods with high glycemic and insulin indexes as snacks, generally not required if insulin is balanced. For slimming, it's important to boost the liver and to stimulate the thyroid. For this constitution type, we have available medications that are members of the incretin group and that mimic the action of the GLP-1 hormone, but also drugs that act on GIP or as a glucagon receptor agonist. These drugs specifically reduce waist circumference and improve body composition. Human constitution type 4, lung. The lung type are long-limbed and thin, shoulders are narrow, and the muscular system tends to be hypertrophic. This type often has insufficient vital energy, which is counterbalanced by considerable mental capacity. They tend to envelop autoimmune diseases and allergy. They are easily affected by bronchitis, pneumonia, and laryngitis. Laboratory tests show low levels of iron, calcium, vitamin D, lymphocytosis, and autoantibodies. Sarcopenia and malnutrition is common in patients of this constitution, so their antibodies must be supported. It will be necessary to ensure an adequate intake and absorption of iron, vitamin C, vitamin D, calcium, as well as protein with high biological value. In this constitution type, we have to contrast sarcopenia. Sarcopenia studies highlight drugs modulating muscle balance, including anabolic hormones, selective androgen receptor modulators, and growth hormone. In the near future, myostatin inhibitors could support the development of new drugs designed to block muscle mass loss or stimulate muscle hypertrophy, in combination with antioxidants, NRF2 activators, vitamin D, and physical activity. Human constitution type 5, kidney. The kidney type has hypoadrenalism, which affects the body, psychology, and behavior of a patient. They easily get sick. Key signs are physical weakness and poor defenses. They are vulnerable from all points of view. They are continuously protecting themselves from attacks that originate outside and are felt internally. These types tend to be subject to cystitis and to urogenic disease. Since the kidney is an essential energy in traditional in the Chinese medicine, this type can develop chronic fatigue. Laboratory tests show altered levels of urea, creatinine, uric acids, electrolytes, vitamin D, and proteinuria. Managing body fluids should be favored by avoiding antidiuretic foods and excess minerals and moderating the use of meat, but also plant proteins and eggs, milks, and dairy products for the best form of protein for this constitution type. Sarcopenia can easily develop in this constitution. Sarcopenia treatment have focused mostly on promoting mild resistance training program and functional training. This can be complemented by supplementation with leucine, essential branched amino acids, peptides, uroretin A, and vitamin D. SGLT2 and myostatin inhibitors could be an option. AI can analyze our data, but only we as clinicians can connect it to the human experience. That combines science and empathy to redefine aging, one patient at a time. And don't forget, the good physician treats the disease, the great physician treats the patient who have the disease. Thank you for your attention.
Thank you, dear Tomella.